At least 10 First Nations in northern Manitoba have put travel restrictions and or lockdowns in place. Some have even declared a state of emergency, something the Manitoba Keewait-Nawi Ogamaganak, which represents 26 First Nations communities in Manitoba's north, expressed concern over. We know surge supports are not as robust as they were in earlier waves. It is important for MKO to ensure our communities have access to supports. However, we understand this may be a significant challenge with an overwhelmed healthcare system. According to the Manitoba government, the Northern Health region has just over 1,500 active cases and 27 hospitalizations due to COVID. NDP MP for Churchill Keewait-Niki Niki Ashton put out an open letter calling for help from the military. She said, in part, remote and isolated communities like Mantosippi Cree Nation require particular support. This includes bringing the military back to ensure communities are able to function and limit the spread of COVID-19. Lives are on the line. The military would assist communities with things like running checkpoints, food delivery, and more nurses for checkups and vaccines. The Assembly of Manitoba Chiefs Grand Chief Arlen Dumas issued a response to the call for military help, saying it is a stopgap solution. This open letter and comments by Niki Ashton to the media is for political optics. Ms. Ashton did not reach out to First Nation leadership before sensationalizing the issue of hospital closures and need for emergency staffing. Now, Dumas wrote, AMC is concerned with the long-standing inequalities and insufficient investments in health that put First Nations at a higher risk for more severe outbreaks and outcomes. We require long-term investment and solutions that are First Nation driven. The call for military support disrespects the efforts taken to date by First Nations leadership, the First Nations Pandemic Response Coordination Team, and health leaders in our First Nations. Now, Indigenous Services Canada wrote they are continuing to work closely with Manitoba First Nations communities, regional health authorities, and the province to manage cases of COVID-19 through support planning and preparedness and response activities. Daryl Stranger, APTN National News, Winnipeg.